All right, I think we're going to get started. Welcome everybody to our November DSD updates. My name is Lisa Nolan. I'm a regional resource specialist in Central Minnesota. I am happy to be here and excited to bring you guys a great DSD update. I believe it's tradition that typically Emily Miller and Chad Erdman would do a fun joke at the beginning of our DSD presentation. So I'm being held to that standard today. So I have a couple jokes for you. The first one is, how does a turkey travel? By gravy train. The second joke I have for you in light of the Thanksgiving weekend is, do you ever wonder what sweet potatoes wear to bed? Yammies. So I thought I'd share that with you. Those are some kind of fun, cute jokes that I came up with for you today. So welcome everybody. Okay, so I'm going to go ahead and just give you some information here before we roll into the updates. Everybody has been muted today to reduce potential background noise. And we do encourage you to use the call me option because it does help with the audio connection. And to ask a question today, we ask that you use the Q&A panel on the right side of your screen. And we'll address questions as they come in. However, if there is no response, we do need to take that question back for further consultation. The webinar today is being recorded and the details will be posted on the training archive page when available. So we do have a full session of great information to bring to you today, including Brittany Mogensen and Maggie Munson, who will be speaking on the customized living setting verification. We have Andrew Johnson, who will be speaking on case management face-to-face requirements. We're going to have DHS announcements, upcoming training sessions and webinars, and some resources for you. Please note though, today the information being shared with you during this session is current as of today. We encourage everyone to sign up for our e-list announcements, and that way you're made aware of the current changes in a timely manner. So first up is going to be Maggie Munson and Brittany Mogensen. They have put together some information on the customized living setting verification. And I'm going to turn it over to, it looks like, Maggie.
Yeah. All right. Well, good afternoon, everyone. Thank you for giving me the opportunity to come and chat with you guys a little bit about customized living. As Lisa said, I am on I don't know if she said it, but I'm on the DSD waiver policy and compliance team. And right now I'm one of the main contacts for customized living policy. And so we just want to take some time to walk through some of the more confusing parts of it. I know that customized living has a lot of moving pieces to it. And so sometimes it can be really challenging. And so we just want to take some time out to kind of walk you guys through some of the limitations that exist and how you figure out if a setting is subject to those limitations. So we can just jump right into it. And right at the start here, I just have a little grid. Hopefully this can be something that you guys can use. And it just kind of goes through what limitations exist and who they exist for. And the two things that determine whether or not a setting is subject to a limitation is their customized living enrollment date and their customized living license type. The license type and the enrollment date can both be found in MMIS. And that's what Brittany's going to do later. She's going to walk you guys through how you find it when you're going into MMIS. So as you can see in this grid, if a setting was enrolled prior to May 1st, 2001, so we're going really far back, they are going to have a license type of AL, D, E, or CE. And of course, those two are just recognizing if they're dementia settings or not. Most you're going to see the AL. And if it's before May 1st, it has an AL, this setting has no limitations. The next one is going to be May 1st, 2001 through January 10, 2021. If the date falls between that date span, and they have one of those three license types, AL, D, E, or CE, they're going to be subject to two different limitations, the location limitation and the size limitation. And as we go, we're going to go through each one of these limitations. So if you have questions on those, we'll get to those. Their next date span comes January 11th, 2021 or after. So this one doesn't have an end date. It continues. This is where you're going to see a change in the license type, where we're going to change over to L7, L8, or L9. Again, L8 and L9, you're not going to see as much. Those have to do if it's a special type of assisted living. And these are going to be subject to the location and the age limitation. So one thing that you're going to see as we go through this is any setting after May 1st, 2001, the location is always going to apply. The other ones switch off and on depending on their enrollment date. The third one that we have to look at here is July 1st, 2021. And this has two pieces to it. If their enrollment date is July 1st, 2021 or after, and they are licensed for 4 or fewer beds, then they are subject to location, age, and the CL moratorium. So again, I hope this grid can be something you guys can just use as like a really quick reference guide to kind of remind you of what you should be looking at. And now let's go and jump into each one of the limitations and what they mean. So the location limitation, there's actually two versions of two pieces to the location limitation. And again, like I said before, this is going to apply to anything after May 1st, 2001. This one has no end date to it. The first is that it cannot CL services for BI and CADI. And let me just make sure that that's really clear. We are not talking about CL services for EW in any of this. It's strictly BI and CADI. They cannot be delivered in a setting that's located on the grounds or adjacent to an institution. So think like hospital, nursing home, those types of things. The only exception to this is if they have completed the heightened scrutiny process. So if you guys have been around kind of in this world for a while, you might be familiar that in 2017 and 2018, there was an attestation process. And what this was basically every provider controlled setting that delivered services had to verify the types of services they were delivering and certain elements about that setting. And at that time, if it was determined that this setting was operating on the grounds of an institution, there was this additional process provided by CMS that they could go through in order to show that nothing about the setting led to institutional qualities. So if they went through that process, they are allowed to continue delivering services, even though they're not compliant to the location, the part of the location limitation. But all the information on that, this should be a hyperlink. I don't know when you guys get the PowerPoint sent out to you if you can have access to the hyperlink or not, but that will take you to the list of all the settings that have gone through that heightened security process. And then just real quick side note, because I forgot to mention it first. Any questions that you guys have, if you're throwing them in the chat, I'm going to answer them at the end, just so I can kind of move through the presentation and then have some time for questions. So if you want to go to the next slide, we can look at the second location limitation. Again, anything May 1st, 2001 after, and this has to say that CL services cannot be delivered in settings that are co-located, meaning they're next to one another, and operated by the same provider. Excuse me. And one thing to keep in mind with this one is, or one example for it would be duplexes. There are a lot of assisted livings that are approved in duplexes. If that is the case, they will have what we refer to as a campus license from MDH, recognizing that there's two different settings. They're going to be right next to each other. That means that CADI and BI services can only be delivered on one side of the duplex. EW is not subject to the co-location limitation, so EW can be on both sides, but CADI and BI can only be on one side. Again, there's an exception to this, and that's if they went through that attestation process and they showed, they showed DHS that there is no isolating or institutional qualities in it, then those that existed at that time are allowed to continue operating as normal and are not subject to this location limitation. Two things that I can say about this. One, since the attestation process took place, we've kind of gathered the information to show that a lot of co-located settings have been developed, and we really don't want to disrupt the living situations of people if we can avoid it. And so we are developing a new attestation process that providers can go through. It's providers that were, I think the cutoff date, I'm not sure if 100% it'll stay this, but I'm almost positive it's January 1st, 2023. If they were operational prior to that date, they will be eligible to go through this new attestation process if needed. It's currently in the works of being developed and exactly how it's gonna, what it's gonna look like and how we're gonna process those. So keep an eye out for an e-list. We will send out additional information on that. And then we will also be providing a list of all of the providers that have gone through that attestation process already. So you'll be able to see if that location is good or not. Okay, we can go to the next slide. So that's location limitation. The next one, we're going to talk about the size limitation. And there's been a lot of chatter around this one lately. So I'm guessing that a lot of you are familiar with this. This one does have a time limited piece to it. It's May 1st, 2001 through January 10th, 2021. So again, back on that grid that we showed at the start, if you're looking up somebody's enrollment date and it falls between these two dates, they're going to be subject to this size limitation. So the overall size limitation, the part of it is that for people younger than 55, the setting can serve up to 4 people who are unrelated to the principal care provider. So that's the size limitation in general. One note to this is that if the provider chooses to serve people younger than 55, if all their people are over 55, you don't have to worry about the size limitation. But the moment they decide to serve even one person younger than age 55, and in a setting where there's more than 4 units, they're going to have to follow an exception to the limit. So that's the thing that you need to identify when you're looking at these settings. Is anybody younger than 55 in the setting? Are there more than 4 units? If it's yes to both of those, then they need to follow scenario 1 in the exceptions. And so if you go to the next page, I have the information on the exception here. And so in these situations, there are certain criteria that must be met for us to approve a size limitation exception. And you can see on here, these are the 3 limitations these are the 3 requirements that must be met. First, the person is being discharged from or is at imminent risk of being placed in a hospital, ICFDD, or nursing facility. The person has no other options in their home community. And then this last piece, this is where a lot of the confusion is coming from. The CL setting has more than 4 units, and less than 25% of the units are occupied by people who receive any services from BICAC, CADI, or DD. So if I just take one step back, Kerwin, if you can go back to the previous slide. There's been a little bit of confusion on this, where when people are looking at the size limitation, they're just reading the limitation and then they're stopping. So they're saying, oh, for people younger than 45, or excuse me, younger than 55, the setting can have up to 4 people who are unrelated to the principal care provider. So there's an assumption, no matter what the size of the setting is, they can have up to 4 people. So if it's a 5-person setting, they can have 4 people under 55, and that's not correct. You have to look at the second piece as well that says if they have more than 4 units, there's this second piece that they have to follow. So that's, I think, where a lot of the confusion, both with providers and lead agencies, has come into play. So if you go back to the slide, I have a little example here. So if you have a CL setting that has 8 units, that means the highest number of people, 55 and under, that they can serve is going to be 2, because they need to stay under that 25%. And so you can see 8 times 0.25 is going to be 2. So hopefully that makes sense. Like I said, if you have questions, throw them in the chat, and we'll address them once we make it through the rest of the presentation. All right, I'm just checking my notes to make sure I didn't miss anything that I wanted to mention. Don't see anything so far. Okay, so the next thing that we have is the age limitation. This one is for settings developed or operational on or after January 11th of 2021. Again, this one has no end date. So anything January 11th, 2021 or after is going to be subject to this. And it's that the CL services are limited to people age 55 or older on CADI or BI. So this one, there's no exceptions. If it's developed after that date, nobody under 55 can live there. One thing to keep in mind when you guys are entering this information into MMIS, an edit will pop up. I think it's the 424 edit will pop up, saying like, this, if they're not over 55, don't continue, or 55 or older, don't continue. But that edit can be forced. The reason it can be forced is because that edit has other things attached to it unrelated to the age limitation. So when you're entering stuff into MMIS, if that edit pops up, and the only reason it's going to pop up for you is due to the age issue, don't force the edit. We don't want anybody forcing it. Like I said, there's no exception to the age limitation, so there would be no reason to force that edit. If for some reason the edit does get forced, what will then happen is when the provider goes to bill, they're going to get a claims edit on their side that is going to completely prevent them from billing. And so if you don't want the headache of a provider mad that they can't bill, don't force the edit on the front side, because that person won't be able to live there. They can't bill for it, and that person will have to move. So just something that you really want to make sure that you're aware of. We also provide you guys with a list of all of the settings that are subject to the age limitation. So again, here in the CBSM, there's a hyperlink, and if you go there, it has in alphabetical order all of the settings that are subject to this limitation, and that gets updated on a monthly basis. They run a report each month, and so usually within the first week of the month is when we try to get that out to you. And then one other piece, because this has come up with the age limitation quite a bit, has to do with when there are changes either to ownership or to the location of a setting. So if a setting is sold, that is not going to affect their CL license type. So what that would mean is, if you remember those license types that we looked at in that chart, say that a setting was developed in 2018, they are going to have an AL license type, so you know that they're not subject to the age limitation. When they sell, they maintain that license type. The reason that we do that is that we don't want the people who are living there to have their living disrupted simply because the owner decided to make to do a sale. However, if the owner decides to just move locations, they're not selling the company, they're just changing the address, they're moving to a different house, that will affect the CL license type. So they move from house A to house B, they now need to re-enroll that location, and it's now going to have a new enrollment date and a new license type, and it will become subject to the 55 age limit. So there is a possibility that that change can affect people who are living there. If they're under 55, they're not going to be able to move to that new location. So hopefully that makes sense. If you have more questions, throw them in the chat and we can address them at the end. And then the next thing that we have, and I promise this is the last thing with the date, at least from my side, is the CL moratorium. This is going to apply to settings developed and operational on or after July 1, 2021, and if the setting is serving 4 or fewer people. And just to clarify, when we're saying serving 4 or fewer people, we're referring to not how many people they're actively serving at that time, but how many beds the setting is licensed for by MDH. So even if they only have 2 people, we're referring to the MDH license, the assisted living license. In these settings, excuse me, let me take one step back. So when you're looking at this, the 2 things that you need to look at are in MMIS would be their license type and when their enrollment date was. So if it's after July 1, 2021, that automatically tells you that there's one more check that you need to do. You need to go to the MDH's health directory, where you can look up all the assisted livings, find the assisted living that it is, and see how many beds they're licensed for. If it's under 4, if it's 4 or under, 4 or under, they are not enrolled to deliver CL on CADI or BI. So if you have an individual on CADI or BI that wants to move into that location, they can't unless the lead agency agrees to pay for those services. The lead agency is completely financially responsible for any HCBS services in this type of setting July 1st, 2021 or after, 4 fewer people, 4 people on CADI and BI. So again, something you want to make sure that you're verifying so that your lead agency is not on the hook for something that they might not want to be on the hook for. All right, so our next, oh, you can go to the next one. There we go. So I talked a lot about looking at license types, enrollment dates, that type of thing. So your next question might be, how do you actually find that information? Most of that is going to be available in MMIS. And so now I'm going to hand it over to Brittany, and she is going to walk you guys through how you find this information in MMIS.
Hello, everybody. Can you hear me? I'm hoping so.
Yes,
My name.
we can.
Thank you. My name is Brittany Mogensen. I am the Home and Community-Based Services Waiver Supervisor at DHS here. And I am joining with Maggie here to walk you through some of the things that you can look up in MMIS. So we'll just dive right into it on my part here. So as far as MMIS, prior to authorizing any customized living services, the lead agency must identify the customized living license type and the enrollment date to verify if the setting is subject to any age limitations. So what Maggie's already touched on was the 2 different boxes here. So the setting was enrolled prior to January 11th, 2021. And is not subject to the age limitation. That's where they're going to have the AL, DE, or CE. So that is how those licenses are coded. So AL is just a regular assisted living license. DE is dementia, and CE, I believe, is a different, is an exception kind of part of the assisted living license. The second box there, the setting was enrolled after January 11th of 2021. And is subject to the age limitation. This is where they're going to be coded as the the L7, L8, or L9. So that the L7 is basically equal to the AL, where the L8 is equal to DE, and the L9 is equal to the CE, if that kind of makes sense, if you can follow. So you have one side where they're either an AL if they were enrolled prior to January 11th, if they were enrolled after, then they're going to be an L7 instead. Same thing for the DE. They're either going to have DE if they're enrolled prior to January 11th, 2021. If it was after that date, we would code them as an L8. The same thing for the CE and L9. So where do you find these? So the customized living license type, so that being the ALDECE, L7, L8, or L9, are found on the PLIC screen in MMIS. Now, just a side note on this, I do understand that some individuals probably on this call do not have access to MMIS. And I apologize if my presentation here confuses you, but this is more so just for the people that have access to MMIS or are familiar with what I'm talking about, just to make things a little bit easier. So I understand that some people in this audience may not have access to MMIS, so I apologize for that. And the next box, the customized living enrollment date, is found on the PADD screen in MMIS. So coming up here, I'll show you some screenshots in just a few minutes. So there are some exceptions to these rules here on, and Maggie had touched on these too. So if I could go to the next slide, please. So the 2 exceptions that would be to the assisted living license would be a change of ownership. So like Maggie had said, if the setting has a customized living license type of AL, DE, or CE, so which means that they're currently grandfathered in, meaning that they're able to provide services to individuals under 55, and their enrollment date is after January 11th, 2021, it means that it went through a change of ownership, which doesn't affect the license type, or the provider submitted documentation showing that they were operational and met all customized living enrollment requirements prior to January 11th, 2021. So to explain that, I am selling my assisted living facility to Maggie. I have been, I have an AL license type. I can serve individuals under 55. I'm selling it to Maggie. Maggie buys it, and the effective date would be November 1st of 2023. Well, because I was grandfathered in and was able to serve individuals under 55, Maggie will now be able to serve individuals under 55, if that makes sense there. Or it could be that I am a provider and I want an effective date of November 1st, but I can show you that I was operational and I met all customized living enrollment requirements prior to that January 11th, 2021 date. So what that includes would be showing that I had a housing with services certificate and a comprehensive license covering my location. I would be able to be grandfathered in to serve individuals under 55. And the other exception for MMIS, so Maggie also touched on this, so if a setting has a customized living license type of L7, L8, or L9, and an enrollment date prior to January 11th, 2021, it means that they had gone through a change of address. So I've been providing customized living services since 2020, and I'm going to move my whole location and everything 2 houses down the road. It's considered an address change, and sadly what you do is they would lose those grandfathered rules. So they would no longer be able to serve individuals under 55 if there is a change of address. Next slide, please.
Brittany, can you go back to once? I just noticed an error, so I just want to point it out real quick. On that
Okay.
second one where we have change of ownership location / address, ignore ownership. That shouldn't be there. It's just that one is just for a change of location or address. So yeah, if you keep the PowerPoint, just strike that out.
So many edits and we still miss that. That's crazy. All right, next one, please. Okay, so here is the PADD screen in MMIS. This is showing you the second red box down in the left-hand corner, shows you that this provider has an active status with an enrollment start date of 9/1/2006. So just so you know, all of these screenshots are just separate screenshots. It's not all of one provider. So they aren't going to be consecutive where they build off of each other, just to let you know. But I just wanted to show you where you can find this information within the screen, within MMIS. So one thing I do want to note is the reason why we brought this up is we have a lot of case managers denying providers being able to serve individuals under 55 because let's say their enrollment start date is after January 11th of 2021. So although I really appreciate case managers being on their game and really catching those things, but this is where I want to show you that although sometimes the enrollment start date is going to be different, it all really depends on how they're coded with that AL or that L7, how we talked about that just a little bit ago. So next screen, please. So this is the PLIC screen. So this is showing you that red box in the middle. So the license number is listed there, the begin date, end date, the license type. So the green box is showing you where you're going to find those license types right there. The question, how do you get to the PADD screen initially? So what you're going to do is just when you log into MMIS, you can, up in the top left-hand corner, you're going to see right there, it says PROL. You can actually just type in PADD, but normally this one will pull right up. It should normally be your first screen or not. If not, just transmit and it'll get you to that screen. Okay, next one, please. All right, so this one is showing you that the license type of DE. So this would be if the provider is grandfathered in. You would see if they're considered grandfathered in and they have the DE here, which means they have the dementia care. This is possibly where they would have the enrollment status date of January 1st, 2023. but they have the license coding of DE, which means that they were grandfathered in. And then the next one, please. So this is where you're going to see an address change. What it is you can see the second line with the license number there. From 4723 to 42723, they were coded as an AL, which means they were grandfathered in, able to accept individuals under 55. However, you can see something on 428 happened where their license type changed to that L7. What that means is from 428 and on, they are now coded as an L7, which means to me, it's an address change. So that's what you can see. If there's a change in the coding for some reason, especially in the middle like that, that's going to show you that there was an address change there and they are no longer eligible to serve individuals under 55. Let's see. And I think that is all I have for screenshots to show you. I hope that kind of helps a little bit trying to understand what's going on too with sometimes the enrollment status or the enrollment start date doesn't always match that PLIC screen. So sometimes it's going to be a little bit of conflicting information, but that is why sometimes you're going to see that. So we really appreciate how hard you all work and trying to understand this. I understand is very frustrating sometimes, but we appreciate the hard work that you do with this.
All right, so I'm just going to jump in. It looks like we just had one question that's come in that was not already answered at some point. And the question is there a reason why they do not separate the age edits so that cannot be forced incorrectly? So I'm assuming that's when I was referring to the 424 edit and how we're asking you not to force it for the CL 55 age limitation. Short answer is a system limitation. MMIS only has so many edits that are available. And so the 424 has to do with anything that needs an edit due to age. And so there are some legitimate reasons for other services that there can be an exception due to age. And so that edit needs to be allowed to be forced. And so that's why you just want to be aware when you're getting it, if it's CL and if it's related to the 55 issue, don't force it. We would love it if there could be a separate code for that and to make it so that it can't be forced. But it's just a limitation that exists in the system. As Brittany was just showing you, MMIS is from, I don't know, like the 90s, I don't know, something like that. And so we just don't have as much customization as would be nice to have. So, and one other thing, Kerwin, if you could jump back, I'm sorry, I did forget to mention this. If you could jump back to the size limitation page. So if you have a situation where you think that a setting, or you think that this scenario one, that all of those following requirements are met, there is a form that you would send in to our team. It's the size limitation form. And we go through it. And there's just a bunch of questions that you need to answer. Most of them, you're going to get the information from the provider. You submit it to us, and then we'll either approve it, deny it, or ask for some additional information. One thing I wanted to point out is if this all of these criteria from your best guess should be met to send that form in. So for example, this last one where it says less than 25%, there's a section on the form where you're actually going to do the calculation, saying there's, 10 units there and only one of them has a person on BI, CAT, CADDY, or DD. And then it'll shoot out like, what is it, like 10%. If it's over 25%, you don't need to send us the form because we're just going to deny it automatically. You can just let the person and the provider know that they don't meet the requirements. So we've been getting a lot of forms lately at 80%, 60%, things like that. You don't need to get an official denial from us. If you as the lead agency recognize that they don't meet those requirements, you have the authority or ability, whatever you want to call it, to just tell them that that person would not be allowed to live in that setting. Okay, so if you want to go back to that resource page, thank you for going back there real quick. These are some resources that are available to you guys. The number one thing is going to be the customized living page in the CVSM. I know that I have it like tabbed on my browser because I go to it numerous times a day. It's a really, really good resource for you. There's some additional things on there. And then of course, we're always available to answer questions that you guys might have. I don't, let's see. So question, how does DHS hold providers accountable for following the rules? I understand there's a 6189X in MHCP forms, but we have found that providers still don't follow these. So who holds them accountable and what happens to them if they don't follow the rules? Seems like there's little accountability and oversight and no consequences for providers who do not follow these limitations. It's a really good question. It's something that we've gotten asked quite a bit. And speaking to, I'm assuming what you're referring to is knowing what they might be, limitations they might be subject to, making sure that they follow those. So really it's a joint effort by the lead agency and by the provider. The provider should know and understand they're delivering customized living and what their limitations are, right? So when they're sharing that information with you, they should be giving you accurate information. However, the lead agency is also responsible to ensure that you're only authorizing eligible services. And so there is that part where you as a lead agency also have to verify that information that you're being given. There are different avenues that you have to take if you find that information was not provided correctly and therefore there's an ineligible person at a setting. There's of course CSRS referrals, those types of things to follow up on it. But yeah, providers are required to be compliant with all program requirements. So yeah, if you suspect that they're not, again, make a CSRS report, contact their licensor, things like that. But again, it is that joint effort between both the lead agency and the provider to ensure that both things, both people are delivering eligible services and authorizing eligible services. All right, so I don't see any other questions for customized living. You can pop in and let me know if I'm missing something. But I just want to go over this next one as well. So along with customized living, I also work on integrated community supports. And we, as you all know, this is a fairly new service, just started in January 1st, 2021 for some waivers, and then January 1st, 2023 for others. So now that it's fully out there, we wanted to get some feedback on how things are going. So we've already done some focus groups with lead agencies and providers. And the next step, and arguably the most important step, is to get feedback from individuals who are actually receiving the service. And so we need a little bit of help in this. You may have already received an email from us asking for assistance. And basically what we're asking if case managers can do is if you have anybody on your caseload who either currently receives ICS or has received it in the past, to ask them if they would like to participate in a survey and or a focus group with us. The survey is going to be open for completion all of December. I think it's like the 4th through the 21st or 22nd. And then the focus groups will be held in January. And the way that they do it is on the email that we sent out to all case managers, there's a link to the VIP, the Virtual Insight Panel. And they can go on that website, sign up, and then they'll get a link to take this survey. The reason we're doing it that way, the reason there's that extra step where they have to sign up through the VIP is that it allows us to reimburse them for their time. So if they complete the focus group, or excuse me, if they complete the survey, they'll get a $15 gift card. And if they do the focus group, they'll get a $25 gift card. And so we really value their input and we want to recognize how important their input is to us. And so that's why we want to ensure that we're able to reimburse them for the valuable information that they're giving us. So I would really encourage you guys to send this out to anybody that you have with ICS and encourage them to share their information with us. Really the only way that we can make improvements to the service is if we know what's going good and what's not going so good. So we appreciate your help with that.
Thank you so much, Maggie. Thank you, Brittany. Next, we would like to introduce Andrew Johnson, who will be speaking to case management face-to-face requirements. So if you have questions regarding Andrew's presentation, we would like you to submit those through the Q&A panel. And then we'll take a moment to pause after the DHS announcements to allow Andrew to return, answer those questions related to this topic. But if you do not receive an answer to your submitted question, please note that we will submit those. We would like you to submit those questions on the DSD contact form. So I'm going to go ahead and turn this over to Andrew.
Hello, thank you, Lisa. As Lisa shared, my name is Andrew Johnson. I am the Support Planning and Informed Choice Team Lead in the Disability Services Division, previously a case manager, and currently I'm responsible for some of the COVID-19 unwind policies. So today we're going to be talking about case management face-to-face requirements. As of November 1, 2023, lead agencies must meet case management care coordinator face-to-face requirements. Face-to-face requirements may only be met with an in-person meeting. Virtual visits can no longer be documented as a face-to-face visit. You know, case management face-to-face meetings are federally required as documented in each waiver plan. So for the disability waivers, that's BI, CAC, CADI, and DD, the waiver case manager must meet a minimum of 2 face-to-face contacts within the 12-month period, and the person's annual reassessment may count as 1 face-to-face contact when case management activities are performed at the time of the visit. And you'll see that for AC, ECS, and EW, the waiver the case manager care coordinator must conduct at least 1 face-to-face visit per 12-month period. And this visit can be included as part of the person's annual reassessment when the assessor is also the case manager care coordinator. For more information, please review the April 4th eList announcement that's been hyperlinked at the bottom of this slide. So case management visits that were held remotely before November 1, 2023 will be counted as a face-to-face visit. This means that for waiver spans beginning before November 1, 2023, each visit held remotely that occurred before November 1st will be considered a face-to-face meeting and count towards compliance requirements. To help with your understanding of this change, we provided a couple examples on the screen. Example 1, a person whose waiver span that begins on or after November 1, 2023, face-to-face visits must occur in person to meet compliance requirements. And example 2, a person whose waiver span that begins before November 1, 2023, and has an end date after November 1, 2023, each visit held remotely before November 1 will be considered a face-to-face meeting and count towards compliance requirements. However, remote visits held on or after November 1, 2023 will not meet compliance standards unless they're in person. And you can find more information in the link at the bottom of this screen on case management face-to-face requirements. So there is a long history of statewide face-to-face compliance in Minnesota. You all have done a great job there. So what is the compliance been and what is it today? Overall compliance statewide for all waiver programs was at 95% from August 2015 to November 2018 in round 3 of lead agency review. And it was 99% from April 2019 to August 2023 in round 4, with 97% compliance prior to the COVID-19 public health emergency. So as you know, the person is at the center of what we do. All meetings must be coordinated based on the person's preferences, their needs, and in a way that supports their choice and control. This may include decisions about meeting frequency, location, participants, time, scope, and other factors. So choice, health, and safety are critical factors to consider when coordinating meetings. Whenever a person is unable to meet face-to-face, it's important to first understand why. and make attempts to address their concerns. So what should you do when a person does not want to meet face-to-face? When this situation arises, consider asking questions to understand their concerns. Share how not meeting in person may limit your ability to understand and address their needs. There might be other factors that influence your ability to support them. And position the person to have choice and control that addresses their concerns by helping them to define what they would like to discuss, who they would like to be present, where to meet, when to meet, and how to structure the meeting. For example, what do they want to talk about first, second, third? What are the agenda items of the meeting? There might be others. And whenever planning and coordinating a meeting with the person, create a meeting environment that encourages the person to feel comfortable sharing their opinions, advocating for their goals, and engaging in the process of building their support plan. So we've provided the following as an example. Jose has been receiving disability waiver services for the last year. They have not been willing to meet with their case manager in person since the initial assessment and planning meeting. The case manager has been unable to hold a second face-to-face contact with the person. The case manager learns from Jose's emergency contact that they have been experiencing an increase in social anxiety. So in this situation, Jose really is not refusing to meet with their case manager. And to determine next steps, the case manager needs to not only consider the face-to-face requirement, but to also consider how ending critical support for Jose may impact their health and safety, to consider whether Jose is receiving sufficient monitoring to ensure their health and safety, and consider how you might promote choice and control as we shared earlier in this presentation. So we must always honor a person's choice and meet them where they are at. As you know, the waiver programs are voluntary, and determining the best course of action when a person will not meet face-to-face with their case manager requires professional judgment. Each situation you may encounter may have unique considerations. These can be difficult decisions. When coordinating a face-to-face case management meeting, take a person-centered approach. Prioritize choice, control, health, and safety. And remember that when closing a person's waiver, it's really not, it should not be the first course of action. It should not be the first course of action to leverage people to meet on the basis of meeting requirements. In fact, doing so could cause significant harm to the person and your working relationship with them. Face-to-face case management meetings are a key part of planning and monitoring. An individualized plan for monitoring must be documented in each person's support plan. When a person does not agree to meet face-to-face, you should document this discussion and the choice the person has made in the person's plan for monitoring. However, it's important to note that while you must document the plan for monitoring, documenting a decision to not meet face-to-face does not meet face-to-face meeting requirements. So as a reminder, all actions to exit a person from the waiver must be consistent with the continuous coverage requirements and the unwind period. So for more information, you can review the April 11th, 2023 eList announcement at the link provided. These are challenging decisions to navigate. When exiting a person for not meeting the face-to-face requirement, carefully consider this decision. Consult your supervisor and any applicable lead agency practices. Thank you for your time. I'll circle back to answer your questions.
Thank you, Andrew. Good afternoon, everyone. As we said earlier, we will take a pause after the announcements to allow Andrew to return and answer questions that were sent in. Hello, everyone. My name is Jody Lewis, and I'm a Regional Resource Specialist. I support the metro area counties, and we are going to now move into the DHS announcements. The Aging and Adult Services Division, AASD, and Disability Services Division, DSD, have made changes to our e-list announcements to help simplify our communication and reduce the number of messages subscribers receive from DHS. We are now distributing a weekly e-list on Tuesdays that contains all announcements for the week. Occasionally, we will need to send e-lists outside of the weekly announcement about timely matters. These may include emergencies or disasters, critical system messages, critical incidents, or messages to a very specific audience. People new to AASD and DSD e-lists can subscribe on either the AASD or DSD e-list CBSM page, depending on the people that they serve. On the slide, we have included a screenshot of what the weekly update will look like when it comes through your email. Part 2 of the Partner Advised rolling launch of the revised MinChoices application started on Monday, October 2nd. Please note there has been an update to the rolling launch schedule. The new schedule extends Phase 2 until March 29th, 2024. Please reference the November 9th e-list for more information about the extension. During Phase 2, lead agencies should continue to assign staff members to practice in the MinChoices training zone, have at least 30% of users work on health risk assessments, MinChoices assessments, and support plans in the production environment, allow other lead agency staff members to continue using legacy systems, and complete County of Location assessments in MinChoices 1.0 or the revised MinChoices application at the county's discretion. For specific information about MinChoices updates, visit County Link MinChoices, and for questions about the MinChoices revision project, you may send an email to dhs.minchoices@state.mn.us. As a reminder, the next MinChoices support session will be held on December 1st. To access presentations and recordings of past launch webinars, you can go to the Webinar Training Archive, Disability Services Division, and select MinChoices. The new LTSS remote assessment policy went into effect November 1st, 2023. Remote reassessments conducted by interactive video or telephone may substitute for in-person reassessments in certain circumstances. For AC, ECS, and EW, lead agencies must review the previous year's assessment to determine if a person meets the requirements to complete their next reassessment remotely. For the disability programs, BI, CAC, CADI, and DD, lead agencies must review the previous 2 years' assessments to determine if a person meets the requirement to complete their next reassessment remotely. Please review the updated assessment applicability and timeline CBSM page to review this updated policy and the other situations when an in-person assessment is needed. If a person is eligible for a remote reassessment, the lead agency must provide information for the person to make an informed choice between a remote and in-person reassessment. Informed choice means a person understands all options available to them, including the benefits and risks of their decision. When providing information about remote and in-person reassessments, the lead agency must consider what information is important for the person to make an informed choice. Some examples of that can include potential communication considerations, such as the need for an interpreter, hearing loss, or memory loss, the person's individual situation, such as a recent move, hospital or institutional stay, or changes to the person's physical health, mental health, or support needs, or the person's preferences, concerns, and feedback about the information provided. When selecting a remote reassessment in MinChoices, the lead agency must document in the corresponding text box that they offered informed choice. For additional information about informed choice, refer to CBSM Guide to Encouraging Informed Choice and Discussing Risk. The Department of Human Services has stopped requiring parents to pay monthly fees for children with disabilities who get their medical assistance coverage through the Tax Equity and Fiscal Responsibility Act option, known as TEFRA, or through assessments for home and community-based services. The change took effect July 1st, 2023. Parents remain responsible for parental fees through June 30th, 2023. In addition, parental fees remain in place for out-of-home placements. The bulletin linked on the slide provides a contact for people, families, and those who support them to call and determine the fees owed. DHS will implement rate and budget increases on January 1st, 2024, which will affect multiple programs. Rate changes will occur on a rolling basis throughout 2024 and will apply at the time of a person's service renewal or service change. Just a reminder that lead agencies should not make rate changes for any dates after 12/31/2023 until they have received the all clear to do so. DHS will send future communications as we update rate and budget related eDocs, policy pages, and instructions. For the full list of rate and budget increase, see the e-list linked on the slide. DHS is continuing to work with the Centers for Medicare and Medicaid Services, also known as CMS, on preparing a formal submission of a state plan amendment for CFSS. A specific launch date for CFSS will not be available until CMS approves the state plan amendment, but we will continue to provide updates as more information becomes available. We have committed to giving a 90-day notice prior to launch to our external partners. For more information, please visit the website linked on the slide. If you have specific questions related to CFSS, you can send an email to dhs.cfss@state.mn.us. This is just a reminder that the exception that allowed parents, step-parents, and legal guardians of minors, as well as spouses, to continue to serve as a PCA worker for their family member ended Saturday, November 11th, 2023. Case managers should be working with participants to plan for the transition away from this. Effective retroactive to May 1st, 2022, people who used the DD waiver and were temporarily admitted to certain settings for up to 121 days may restart waiver services without an assessment when they are ready to return to a community setting. MMIS can now apply this policy for a person using the DD waiver. If the lead agency has already entered a waiver exit, no action is needed. Contact the service agreement and screening document support team for help reopening the waiver. We wanted to make you aware that the microgrant program window is open. The microgrant is a grant program that is offered to people with disabilities and can be used for employment, housing, or community integration goals with award amounts ranging from $100 to $2,000. The application is review and grant award process may take up to 45 days to complete. Applications will be accepted from the person, their support staff, family, and friends. Only one microgrant per year may be awarded to a person. If you would like more information, you may contact the ARC at microgrants@arcminnesota.org or call 952-920-0855 with questions. We wanted to alert you to a new resource for assistive technology and service planning guidance for people on the brain injury, community alternative care, community access for disability inclusion, and developmental disability waivers. The resource provides lead agencies and providers with guidance and answers to frequently asked questions to use when helping people access support technology. We are currently looking for at least 12 more parents with a disability who could benefit from an assistive technology assessment, adaptive parenting equipment, or a home modification. Live Life Therapy Solutions, who currently operates the Tech for Home grant, was just awarded a new state-funded grant called Parenting with a Disability. Parenting with a Disability funding can be used when it is the only option for the AT assessment or training. Live Life Therapy Solutions can remain involved until other services can be established, clinic or waiver billable, through June 30th, 2024. The PWD grant can provide assistive technology, adaptive parenting equipment, and home modification consultation in instances where these services or devices could help a parent with a disability with tasks pertaining to parenting their child. PWD grant allows time for training and education for others, including an individual's family members, medical team, and others in the individual support network, each in conjunction with AT consultation assessments and follow-up visits. You can make a referral through Live Life Therapy Solutions webpage or by calling Sue Redpenning directly at the number listed on the slide. We have also linked the referral page on the slide. Time and funding are limited. That is all for the DHS updates, and I'm going to now hand it back over to Lisa. Thanks, everyone.
Thanks, Jody. We're going to just take a moment here and welcome back Andrew Johnson to answer any questions related to case management face-to-face requirements. Again, if you did not receive an answer to your question, you can submit that on the DSD contact form. I'm not sure if there are any other questions, Andrew, that came in for you.
Yes, there was a question that came in where a person asked if case management, when performing an assessment, if the assessor is meeting with the person, can that also count as a case management face-to-face visit? So for the disability waiver services, when a certified assessor completes the assessment, who is acting as the case manager, they must be performing case management activities to fulfill the face-to-face requirements. So prior to November 1, these may have been performed by phone or remotely. All right. And let me take a look here. Another question came in where a person asked if the person refuses to meet face-to-face, and we document that in the support plan, and we continue to try to address the barriers, will this be counted as compliant when we document that in the support plan? And the answer is no, it will not be. It is best practice to document those decisions in the support plan. However, face-to-face meetings must occur in person after November 1, 2023. Okay. I don't see any additional questions that I can take right now, but if you have questions that are unanswered, please send those in to the DSD contact form. With the DSD contact form, we'd be happy to get back to you.
Awesome. Thanks, Andrew. Thank you for being here. All right. We're now gonna move on to highlight some upcoming training sessions and webinars. We wanted to remind you of the upcoming Building Your Skills session for the remainder of 2023. Each month, we'll focus on a different area of foundational knowledge and skills that are needed for effective support planning. So please note there has been an update to the 2023 schedule. The remaining session now will take place on December 20th, and sessions are available to register via TrainLink. All right, DHS is holding quarterly webinars for anyone interested in the Disability Waiver Rate System, or DWRS. There is one final session for 2023, which you may register again on TrainLink for. An e-list also will be sent out prior to each meeting with agenda details. All right. The Moving Home Minnesota team holds quarterly community of practice meetings for Moving Home Minnesota and relocation service coordination providers and lead agency representatives. At these meetings, they come together to discuss best practices, updates, and provide feedback on policies and services. It is also an opportunity to share resources and find ways to work together. Their next meeting is scheduled for December 13th from 10 a.m. to 12 p.m., and this will be held virtually. Additionally, they will begin offering quarterly virtual office hours for Moving Home Minnesota and RSC providers only, and then they're going to offer a separate time for lead agency representatives. So if you're interested in any of the mentioned meetings above and or would like to be added to their mailing list, please email the team at movinghome mn.mfp@state.mn.us. All right, the DSD training news and information page. This is where you're going to find the latest trainings and webinars offered through our division. You will also find a link to the DSD training archive page that lists all the past DSD training and handouts that we've recorded. We recommend you bookmark this page and stay up to date on all the most current trainings. We wanted to also make you aware of some self-paced trainings that are available through TrainLink. And as a reminder, case managers who work with a person on BI, CAC, CADI, and DD waiver must complete the course Supporting a Person's Move, a Case Manager's Role. This course is an online, on-demand course for disability waivered case managers to guide them through their role and responsibilities in supporting a person and to find a new home. All right, so the recording of the Major Initiatives webinar from the 2023 Odyssey series is now available online. During the 2-hour session, DHS staff members described 4 major initiatives that should help to better serve and support older adults and people with disabilities. The 4 initiatives described in the webinar include Community First Services and Supports, CFSS, Electronic Visit Verification, EVV, Revised MnChoices Application, and Waiver Reimagine. Okay, the next section here is going to provide you with some resources that'll be helpful to you and the people you support. So we want to remind you that DSD has a website that contains information and resources related to the direct workforce shortage. It provides information such as state-sponsored work groups and provider resources. And we do encourage you to look at this page and keep updated regarding current efforts to address the workforce shortage. This next slide here is a few additional, there's a few links and additional resources regarding the workforce shortage that we have discussed in previous DSD updates. Recently added was the Follow Your Heart to a Caring Career campaign that encourages anyone who wants to make a difference in the lives of others to consider employment serving Minnesotans with disabilities and older adults across the state. This next slide, we want to highlight our DSD contact form and to remind you where to submit questions to DSD. The DSD contact form provides a consistent way for people to submit questions to get technical assistance for DSD related topics. And then last but not least, here are some resources or some of our foundational resources for communication and policy references for DHS. All right, and we want to thank you guys for joining us today. To reach the RRS team for technical assistance, or if you have any additional questions about the information contained in this presentation, please submit them using the DSD contact form. And I want to thank you all again and hope you have a nice holiday. Thank you.